1. Diabetes. Mellitus aspartame has also been blamed for causing type 2 diabetes mellitus, T2DM, and may not meet the expectation of being a healthy alternative to sugar in sweetened beverages. A recent study investigating the effect of sucrose-sweetened and artificially aspartame-sweetened food and drinks on inflammatory markers in overweight subjects found that consumption of sweetened items significantly increased plasma haptoglobin and transferrin, but did not significantly increase the C-reactive protein level. This study corroborates findings from others that suggest that the pro-inflammatory process underlying the greater risk of diabetes may be exacerbated by a high intake of rapidly digested and absorbed carbohydrates and artificial sweetener. Unfortunately, the link between non-nutritive sweeteners, NNS, and T2D risk remains unclear, and the relationship is complicated by factors such as obesity or intestinal microflora. The true relationship between NNS and metabolic disease is unclear. Many of the available studies could not be considered reliable, as the criteria for inclusion of patients were not clear and risk factors for diabetes were not included. It has not been confirmed that NNS intake is directly associated with T2D, or whether it has favorable or harmful effects on the disease. No solid conclusion has been drawn in systematic reviews and meta-analyses due to the wide range of study types and designs. Well-designed studies are urgently needed for covering all types of potentially interfering factors and those which play a role in T2D development. 2. Impact of aspartame on children and fetuses. A healthy diet is particularly important during pregnancy to allow the proper development of both mother and fetus. Many prospective cohort studies note a relationship between artificial sweeteners, ASW's consumption, and putting on weight in children. Low-calorie sweeteners, LCS, are regarded as safe to consume during pregnancy and lactation if recommended levels are not exceeded. However, some reports have associated preterm delivery and allergic diseases in offspring with consumption of ASWs in beverages. Despite this, a review of papers found no such association between ASW and preterm delivery, while a recent study found aspartame metabolism products to cross into the placenta. A dose of 200 mg per kilogram of body weight of aspartame, i.e., 4 to 5 times higher than recommended daily intake, was not found to result in methanol poisoning or mental retardation caused by increased Phe level in the blood of offspring, suggesting that consumption within recommended levels should not cause adverse effects to the fetus. Another study on fish embryos from Medica, Oryzius latipes, found that aspartame treatment increased embryo heart rate, gently decreased head growth, and caused anxiety-like behavior. Interestingly, aspartame in combination with caffeine demonstrated a lower increase than caffeine alone and caused advanced eye development and decreased hatchling body length. The authors ranked aspartame in second place for developmental toxicity. A study on the impact of consumption of low doses of aspartame and stevia with obesogenic diet on rat dams and their offspring found that consumption of aspartame during lactation and gestation by rat dams increased obesity in offspring at weaning and had a detrimental effect on glucose and insulin tolerance, which only occurred in male offspring. In addition, the intestinal microbiota of the offspring was altered, and aberrations were observed regarding gene expression in the mesolimbic reward system. This research concluded that aspartame consumption had a greater impact on male offspring, associated with higher susceptibility of male offspring to maternal stress and diet during pregnancy. Similarly, adult rats whose mothers consumed aspartame during pregnancy demonstrated greater weight gain and higher plasma glucose, LDL, and total cholesterol than controls. The results imply that prenatal exposure to aspartame can impair learning. Such mice may also have an impaired system of satiety and an unbalanced metabolism due to the increased Phe levels in the blood, which is transformed by other metabolic pathways. 44-57-58. Aspartame use has also been associated with increased risk of type 2 diabetes, cardiovascular diseases, non-alcoholic fatty liver disease, and hormone-related cancers. 59-66. Studies also indicated elevated risk of early menarche among girls aged 9 to 10 years, 11 years old.